If you've noticed changes in your body after 60 and sexual activity has become less frequent or stopped completely, you need to hear this. I'm Dr. Baylor Scott, and as a urologist, I've had thousands of conversations with patients who think these changes are just normal aging. They're not. Your body is responding to the absence of sexual activity in 5 specific ways, and the good news is every single one of them is reversible. By the end of this video, you'll know exactly what's happening and what to do about it. So let's get right into it. The first change is reduced blood flow, and this one surprises most people because they think sexual health and heart health are separate. They're not. When you're sexually active, your body increases circulation to your pelvic region. Blood vessels dilate, your heart rate increases, and oxygen-rich blood floods the area. It's exercise for your cardiovascular system. When that stops, those blood vessels get less use. Think of it like a garden hose that sits in the garage all winter. The rubber gets stiff, less flexible. The same thing happens to your arteries and the small blood vessels in your pelvis. For men, this means reduced blood flow to the penis, which over time makes achieving an erection more difficult even if you want to. For women, it means reduced blood flow to the vaginal tissue, which leads to dryness and discomfort. But here's what most people miss. This isn't just about sexual function. Reduced pelvic blood flow is an early warning sign for cardiovascular problems elsewhere. Your heart, your brain, your legs, they all depend on healthy circulation. So the reversal isn't complicated, but it is necessary. You need to move your body every single day. I'm not talking about running marathons. A 20-minute walk increases circulation throughout your entire body, including your pelvis. Add in some basic stretches, especially hip openers, and you're actively reversing this decline. If you do nothing else from this video, start walking today. Now let's talk about change number 2, and this one affects both men and women but in different ways. Hormonal decline. Your body produces testosterone and estrogen partly in response to sexual activity. It's a feedback loop. When you're sexually active, your brain signals your endocrine system to keep producing these hormones. When you stop, that signal weakens. For men, testosterone levels drop faster without regular sexual activity. You might notice less energy, reduced muscle mass, brain fog, even weight gain around the belly. For women, estrogen levels decline, which accelerates after menopause anyway, but the lack of sexual activity makes it worse. Lower estrogen means thinner vaginal tissue, bone density loss, and mood changes. Here's the reversal, and it's simpler than you think. Your body doesn't know the difference between partnered sex and solo sexual activity. Masturbation triggers the same hormonal response. I know this might feel uncomfortable to talk about, but from a medical standpoint, it's health maintenance. If that's not an option for you, there are other ways to support your hormones naturally. Strength training, even with light weights, signals your body to produce more testosterone. Eating healthy fats like avocados, nuts, and olive oil supports hormone production. And getting sunlight every day helps regulate your entire endocrine system. These aren't replacements for hormone therapy if you need it, but they absolutely help. Change number 3 is one I see in my office constantly, and most people don't connect it to sexual inactivity. Pelvic floor weakness. Your pelvic floor is a group of muscles that supports your bladder, bowel, and sexual organs. When you're sexually active, those muscles contract and release repeatedly. It's a workout. When that stops, those muscles atrophy just like any other muscle would. For men, this leads to urinary dribbling, difficulty fully emptying the bladder, and sometimes erectile difficulties. For women, it's stress incontinence. You cough, you sneeze, you laugh, and you leak. It's embarrassing, and it makes people withdraw even more. But here's the truth. This is completely reversible with targeted exercise. I want you to try this with me right now. Sit up straight. Now tighten the muscles you would use to stop urinating midstream. Hold for 5 seconds. Release. That's a Kegel exercise. Do 10 of those 3 times a day. It takes 3 minutes total. Within 2 weeks, you'll notice a difference. Within 6 weeks, most of my patients report significant improvement in bladder control. And here's the bonus. Stronger pelvic floor muscles improve sexual function if and when you decide to become active again. So even if you're not sexually active now, you're preparing your body to have that option later. Now we're at change number 4, and this one affects your brain more than your body, but the two are connected. Mood and sleep disruption. When you have sex or any kind of intimate physical contact, your brain releases a cocktail of chemicals. Oxytocin, the bonding hormone. Serotonin, which regulates mood. Endorphins, which are natural painkillers. When sexual activity stops, your brain produces less of these chemicals. Over time you might notice you feel more anxious, more depressed, more irritable. Your sleep suffers because serotonin is also a precursor to melatonin, the sleep hormone. I've had patients tell me they've been on antidepressants for years, and when we dig into their history, the mood changes started right around the time sexual activity stopped. Now I'm not saying everyone should throw out their medication. Not at all. But I am saying there are natural ways to trigger these same chemicals. Physical touch still matters even without sex. Hugging, holding hands, even petting a dog or cat releases oxytocin. Massage does the same thing. Exercise releases endorphins, which is why people say they feel good after a workout. And sleep hygiene, like keeping your bedroom cool and dark and going to bed at the same time every night, helps your brain produce melatonin naturally. If you've been feeling low and you're not sure why, look at your physical connection to others. Are you touching anyone? Are you being touched? If the answer is no, that's a gap you need to fill, even in non-sexual ways. Change number 5 is the one most doctors don't talk about, and it's the most gender-specific. For men it's prostate health. For women it's vaginal atrophy. Let's start with men. Your prostate gland produces fluid that's released during ejaculation. When you're sexually active, your prostate is regularly emptied. When you're not, that fluid sits there. Over time, this contributes to prostate enlargement and increases the risk of prostatitis, which is inflammation of the prostate. Some studies even suggest that regular ejaculation, at least 21 times per month, is associated with lower prostate cancer risk. Now I'm not saying lack of sex causes cancer. I'm saying regular ejaculation, whether with a partner or solo, is part of prostate maintenance. For women, vaginal atrophy is a real concern. Without regular blood flow and stretching of the vaginal tissue, the walls become thinner, drier, less elastic. This leads to pain during any kind of penetration, even a pelvic exam. It also increases the risk of urinary tract infections because the tissue is more fragile. The reversal for men is straightforward. Ejaculate regularly, even if it's solo. If you have symptoms like difficulty urinating or pelvic pain, see a urologist. Don't wait. For women, vaginal moisturizers and lubricants help, but if the tissue has already thinned significantly, you might need a prescription estrogen cream. There are also vaginal dilators that help maintain elasticity. These aren't sex toys. They're medical devices and they work. The key is don't ignore these changes. They get worse over time if you don't address them. So now you know the 5 changes. Reduced blood flow. Hormonal decline. Pelvic floor weakness. Mood and sleep disruption. Prostate and vaginal health decline. Every single one is reversible, but only if you take action. Let me give you a simple action plan you can start today. First, move your body every day. Walk, stretch, do anything that increases circulation. Second, do your pelvic floor exercises. 3 minutes a day, that's it. Third, find ways to experience physical touch, even non-sexual. Hug someone, get a massage, spend time with a pet. Fourth, if you're comfortable with it, maintain solo sexual activity. Your body doesn't care if it's partnered or not. The health benefits are the same. And fifth, see your doctor. If you're a man over 60, you should be getting your prostate checked regularly. If you're a woman experiencing vaginal dryness or pain, talk to your gynecologist about treatment options. These are not things to be embarrassed about. They're normal parts of aging and they're treatable. I want to hear from you. If you made it to the end of this video, comment the words healthy aging below so I know you're with me. And if this information helped you, Make sure you subscribe because I'm making videos like this every week to help you stay strong and healthy as you age. Next, I want you to watch my video on the 5 things that happen to your joints when you stop moving. A lot of the same principles apply, and you'll learn how to keep your body flexible and pain-free. That video is right here. I'm Dr. Baylor Scott, and I'll see you in the next one.